Well, hello. Well, let me take off my checkered flag mask again. Hello, my name is Steve Long. I'm the CEO here at Hancock Health, Hancock Regional Hospital. You know, it's been a while since I wore the checkered flag mask, and I'm doing that really in honor of a guy who gave me a helmet. So I don't know if you can see this or not. His name is Victor Valley, and he drove a go-kart for us in a fundraising event for the Boys and Girls Club the last couple of years. He gave me this as a gift. I just wanted to say thanks to him. You may or may not know, but I'm a big racing fan, and we've had race cars my whole life, so that is a big part of who I am, in addition to being a dad and a husband and a Christian. So all of those things define who I am. Anyway, that's why I broke out the checkered flag mask. But as you might know, I've been wearing this other kind because it's been more comfortable. Well, I want to take just a minute to remind us of where we're at in the pandemic right now. And last time I shared my screen and showed you some of the data that I look at. So I'm going to do that very quickly again right now. And we're just going to go and take a look at what we've got. So I'm going to start with the Indiana State Department of Health. So you can go out to their website at any time, look at the dashboard, and what you will find is exactly what I'm looking at here. So this is the COVID-19 data report. And today, which is December 14th, so over the last 24 hours, we've had 5,000 new cases in the state of Indiana. 5,000 new cases, 35 new deaths, 430,000 total positive cases now, and almost 5 million people tested. That's a huge bunch of the state. You then can look down and you can see the map, and you can see there's a whole lot of red on this map, including Hancock County. There we are right there. We are red along with many other parts of the state. And you may know red is not good. Yellow's the best. There's no yellow. It's all either orange or red. We can look down here a little bit farther and look at the case numbers, and you can see that, wow, my goodness, the cases really spiked up and they've been staying kind of high for the last several weeks. This is kind of where the concern is. Clearly, so has the testing, but if you look at the testing, it's kind of stabilized now as well. We like to look at, like is not the right word, right? But we prefer to look at deaths and hospitalizations as maybe a better way to look at the pandemic. And you can see in terms of deaths statewide, while they're much higher than they were back in the spring, and they have been staying at that very high rate. If we look down just a bit farther, we can look at the resource utilization, which is really hospitalization. So if we look at this chart here, this is the number of people in the hospital with a COVID-19 diagnosis, and you can see it is far, far higher than it was in the spring. I mean, back in the spring, we were looking at, 1,500 a day across the state. Now we're looking at, 33, 34, 3,500 people. And if we were to look at admissions, we can see that compared to the early part of the pandemic, and in fact, compared to the summer, where there were maybe 40, 50 admissions a day for COVID-19, we're now looking around 400 a day. So this is in the entire state. So you can see the numbers for yourself. Go out to the ISDH website. And then we're going to look at Hancock County really quickly. So we're just going to go over here. We're going to click on Hancock County. And you'll see when you do this that it'll flash a little bit. And then we scroll ourselves back up and it gives us the numbers for our county. So 78 new cases today, or over the last 24 hours, and 4,000 in total. So that's about 5% of the population of Hancock County. We believe the actual number to be roughly double that. So probably 8,000 people in our county have had the disease since the beginning. We're going to scroll down now here and look at a couple other things. So this shows us the deaths in our county by day. So you can see there was a lull over the summer. That lull is well and truly gone. The positivity rate, you can see on the right-hand side here, has gone up quite a lot. And then if we come down here and we look at resource utilization again, so these are admissions to the hospital for Hancock County residents alone. So you can see there is a much different trend, and that has persisted. I can tell you, when you look at census, we're looking now at all of central Indiana, so you can see that we had a big spike and it has stayed there. But let me kind of go back over here just to Hancock County. During the summertime, it was typical for us to have 1, 2, maybe 3 patients that were in the hospital at any given time with COVID-19. Right now, we're averaging between 15 and 20. Today we have 17, so that's the number we have all the time, a lot more than we had during the summertime. So I just want you to look at this data so that you can look with us and say, yeah, there's something going on here, and it is persisting. Now, we're just part of a bigger picture, so I want to take a look at the easiest to use website, which you may recall from last time is this Worldometer. You know, there's a bunch of them out there. I just like this one because it's easy to use. So it shows that there have been almost 17 million cases across the country so far, more than 300,000 deaths. That's a lot. And we can kind of look down here and see what some of the numbers look like. Now I'm going to click on yesterday because that's a full day and showed 192,000 cases in America. So this is just in the United States yesterday. And if we sort this based on new cases, we see California, wow, 33,000 yesterday. Tennessee, they have not been up at the top before. That's a little surprising. Texas is way down at 7th. Let's see where Indiana is. Well, we were at 10th yesterday. So at Indiana, we had about 5,900 yesterday. So you can look and see what this is looking like across the country. I'm going to scroll us down so we can look at a couple of charts. So these are the number of new cases per day. You can see that we are over 200,000 per day pretty regularly now. So this is 200,000 new cases of COVID-19 per day. That means that every 5 days we have 1 million new cases in America. This is a very big number. We know what's driving this, right? It got cold out. We all went back inside. Gatherings are happening because of the holidays, and we're seeing that most of the transmission now is happening in small groups in people's homes. So when people get together in closed indoor space, not a lot of ventilation, no masks. I mean, let's face it. When you're at home, you're not wearing a mask, even if you have other people that are over. That's when it only takes one person that has contracted the disease to be able to spread it, and it's easy to spread in that indoor enclosed space, poor ventilation, where you're close to each other with no mask. It's just how it happens. And it's happening all over the place. So it's not a surprise that these things are going on. Let's look at deaths, though. So these are deaths in the United States per day. And you can say that we're exceeding now where we were. We're 3,000 a day that are happening, and that's been for the last week or so that we've been hitting that. So we know the numbers are big. Just out of curiosity, I want to look at the world because that's a big number. 73 million people now, 1.6 million people have died. And you can look at this graph and you can see, wow, I mean, these are big, big numbers that are showing up here. And that deaths are almost twice what they were back in the spring. Well, I tell you what, you know, those are the numbers. I wanted you to see that just so that we're all looking at the same thing and we know what's happening here. And it is not good, right? It is not good that we see this kind of growth that's happening. So I want to just talk to you for a few minutes. So our Hancock County Commissioner sent out a letter. Hopefully you've been able to see a copy of this letter. It's posted on a number of websites, and it lays out exactly what's happening and what we should be doing right now at this stage of the pandemic. So look, washing our hands, wearing our masks, keeping our distance. This is what we need to do, especially watching out for gatherings in our homes. That's where it's happening. You know, if we own a business, we should be saying, hey, please wear a mask here. And just out of common courtesy, let's wear a mask, right? It can't hurt. At worst, it can't hurt. And then, you know what? We're all going out to eat. I drive by restaurants all the time. Now, we don't because we have my father-in-law, 87 years old. So we try not to endanger him by putting ourselves into precarious situations. But use takeout, right? Takeout is great. I think we should support our restaurants, but use takeout. And if you're going to go there to sit down, try to go in a time that it's not busy. We just want to be careful. Here's an important one. There are so many people getting the disease now that the contact tracers are almost overwhelmed. I mean, there's 150 new cases a day sometimes in Hancock County, and they have to trace back all of the people that they've been in contact with so that they can tell them. Why is it important to take the call from the contact tracer? Well, it is because a person is most contagious the day before they start to show symptoms. So that if they don't get a call from a contact tracer, and if you're not calling them saying, hey, I'm COVID positive, you need to be careful here, they could easily be out spreading the disease and not even know it because they're not symptomatic yet. So if a contact tracer calls, take the call, right? It doesn't hurt. It's important to do that. If you are sick, stay home. Get a test if you're symptomatic. Call your doctor. That is the key thing that we need to be doing. And by the way, we need to be staying in touch with our doctors anyway because we've seen so many people come into the ER and they really didn't need to get as sick as they are because they put off the screening, they put off the colonoscopy, they put off visiting their doctor because they were afraid of getting COVID. And I'm here to tell you, COVID is bad. There are other things for most of us that are worse. So make sure you see your doctor, get your screenings, get your checkups, because it is far worse to get other things. So what I want to just tell you again is COVID-19 is real, but we are reaching the end of the pandemic. I mean, the end is absolutely in sight. We begin to stick needles in people's arms with the vaccine this Friday, just a few days from now. We're excited about this because it is the way out of the pandemic. It is the way that we get to herd immunity, right? It's through the vaccine. So make sure that when your turn comes around, please think about getting the vaccine. My family and I, we're going to get it. I trust the people that work here at Hancock Health, our physicians, our nurses, our healthcare teams. They've done the research, they've read everything, so have I. And I trust that it's going to be safe and it's going to be effective. And I know there's only one way out of this, and it's with the vaccine. Also want to let you know we have an infusion center that we've stood up to do the monoclonal antibody infusion. So if a person gets sick and they're symptomatic and they've got some other underlying health conditions, man, we can get them in right away, and it will help to prevent the hospitalization and help to prevent death that would come along with a very bad case of COVID-19. So there are treatments that we've got now. So last word, hey, be careful, wear your mask. Regardless of which kind it is, wear your mask, keep your distance, wash your hands, try to avoid those small gatherings, especially in the home. If you're going to gather, try to do it in a place that's outside. Look, I know it's cold. It's cold, so try to do it outside if you can. And just for now, try to avoid those things because we are so close to the end of the pandemic. You know, we can almost taste it. We can see it at the end of the tunnel. We're almost there. So let's be careful for the last several months. We're going to get through this thing. I think next summer is going to be a completely different world. It's going to be almost back to normal. So let's all be in this together. Again, thank you for joining me. This is Steve Long, Hancock Health. Go to our website, hancockregional.org/coronavirus. You see all the latest information. We appreciate your support, and we're looking forward to the end of the pandemic. Thanks for joining me. Have a great day.